Interstitial lung disease, ILD, is a group of disorders that cause inflammation and scarring in the lungs, making it harder for oxygen to move into the bloodstream. Common symptoms include times shortness of breath, times a persistent dry cough, times fatigue, times and chest discomfort. These symptoms often worsen over time, making everyday activities like walking or talking more difficult. Unfortunately, once lung tissue becomes scarred, the damage is usually irreversible. ILD can develop for a variety of reasons, though sometimes the exact cause is unknown, a scenario referred to as idiopathic. Common causes include times long-term exposure to harmful substances like asbestos, silica dust, or mold, often encountered in certain workplace environments. Times certain medications, radiation therapy, and autoimmune diseases, such as rheumatoid arthritis or lupus, can also lead to ILD by triggering inflammation or scarring in the lungs. Time smoking and infections, including recovery from illnesses like COVID-19, may increase the risk or severity of the disease. Alveoli are tiny, balloon-like sacs of air located at the end of the respiratory tree in the lungs, where the vital process of gas exchange occurs. Each lung contains hundreds of millions of alveoli, creating a surface area about the size of a tennis court. The walls of the alveoli are incredibly thin, made up of a single layer of cells, allowing oxygen to pass into the bloodstream and carbon dioxide to be removed. The exchange of oxygen and carbon dioxide in the lungs occurs in the alveoli. Each tiny sac is lined with a very thin layer of cells that allows for efficient gas exchange. When air is inhaled, oxygen travels down the airways and into the alveolus. Here the oxygen passes across the thin alveolar walls, through the pulmonary interstitium, and into the capillaries. The pulmonary interstitium is a thin layer of tissue that supports the alveoli and capillaries. The capillaries are a network of small blood vessels. In the capillary, oxygen attaches to red blood cells, which transport oxygen throughout the body. At the same time, carbon dioxide, a waste product of metabolism, moves from the capillaries into the alveolus to be exhaled. This process works efficiently because the walls of the alveolus and capillaries are very thin, allowing gases to pass through quickly. In interstitial lung disease, ILD, the alveoli become damaged due to inflammation and scarring. Normally thin and flexible, the walls of the alveoli thicken and stiffen as scar tissue builds up. Over time, the alveoli lose their ability to expand and contract properly, making breathing difficult, even during simple activities like walking or talking. The scarring can also affect surrounding lung tissue and blood vessels, potentially causing low oxygen levels in the blood and other complications. In ILD, alveoli become inflamed and scarred, making it harder for oxygen to move from the alveoli into the bloodstream and for carbon dioxide to be removed. The thickened and stiff walls of the alveoli create a barrier that slows or blocks this process, leading to low oxygen levels in the blood, a condition called hypoxemia. As a result, patients often feel breathless, tired, and may struggle with everyday activities. This may also affect the entire body since all organs need oxygen to work properly. Chronic low oxygen levels can strain the heart and lead to complications such as pulmonary hypertension, where the blood pressure in the lungs becomes too high. In advanced stages of ILD, the lung damage can become so severe that even using supplemental oxygen may not fully help. Early diagnosis and treatment are important to slow the disease, improve oxygen levels, and maintain a better quality of life.